Doctor, welcome to Your Health.
Thank you.
Dental implants, what are they?
What are they? In a nutshell, they are new roots of your teeth. There's two parts to the tooth, the root beneath the gum and the crown above the gum. We never could replace the root before, now we can, and we can build numerous things on them to make people more comfortable.
What's so bad about dentures? We've had dentures for so long, people are walking around with dentures. Is there a problem with them?
Well, $140 billion, or $1 million rather, are spent on denture adhesive a year. That signifies a large problem. What people don't realize is that when your jawbone is not stressed, you will continue to lose bone after you lose your teeth. This is traditionally why somebody who has a great denture for 5 years, 5-10 years later, can't get one that fits, because their bone continues to disappear. Implants stop this because they stress the bone and get the bone functioning so it works more like a muscle, so to speak.
What's the procedure behind this? How does it work? Does a person comes to your office and say, I need something done, and you suggest implants? Why don't you tell us what their office visits entail?
The first question I'd ask the person is, number one, do you mind wearing a removable plate? Okay, if they are wearing a removable plate. One or two answers I'm going to get. Doc, I just need something that's a little bit tighter, or I can't deal with this thing anymore. I really want to get rid of it. Give me my teeth back. That is the starting point, and it gives me an idea of where we have to go to get that person comfortable. Either way, we can work something out for that patient that would be significantly better than what they had.
Now, we have some pictures. Maybe we could show
Sure.
what people look like before and after and how they've improved themselves. And here we have them up on the screen. You can comment on them.
Okay, this is a case where someone came in and said, if you look at this upper screen right here, Doctor, I have no teeth. I've been wearing a denture for a lot of years. I want to get rid of the denture. I lose my taste. It falls out. I'm embarrassed in public. So what we suggested to this person is to put 8 dental implants in. As you can see, those small titanium posts that are coming through the gums.
Titanium. Why
yes.
titanium?
Well, in 1980, Dr. Brannemar came from Sweden and basically unleashed 25 years of research that was hidden in a closet that showed titanium binds to bone like nothing else.
So if they don't work, we can use them for our drivers.
You can absolutely use them for your drivers. Yeah,
okay, so that's in the lower left. You replace it with the titanium post. Then what happens after that?
Then what we did is we went ahead and built a non-removable set of teeth.
And that's on the lower right-hand portion of the screen.
And these are the upper teeth that are now screwed in to those posts.
Okay.
And the patient takes care of them like they're the natural teeth. There's nothing covering the palate like a denture. They stimulate the bone so you feel the pressure when you chew, like a tooth would.
Okay.
And a person could bite through next to anything.
What's the picture on the upper left-hand show?
The picture on the upper left shows the old broken down denture. That's a removable plate. If I were to turn that upside down, you could see that the palate would be covered. It's a big piece of plastic.
How many visits does it take to go from the initial visit where you say, I want implants, to where they're actually done?
Okay. The stages of the implant process are as follows. The implants, there's initial evaluation, which is an appointment. The implants are placed. We usually wait 6 months for that bone to bind to the implant.
So the implant, the titanium part, is the long time frame, is what you really need for a long time to settle.
Exactly. And there's no appointments, or very few appointments in between. We're just waiting for the body to do what it's supposed to do. After that, it really will only take 3 to 5 visits to build the person their teeth.
Okay, we have another picture, set of pictures of before and after. And comment on these.
Okay, this is a combination cosmetic dental case as well as a implant case. The front teeth were very broken down. This is a classic case of having teeth patched for many years, filling after filling after filling. Okay, picked up stain. This woman had lost her back teeth and would have needed a partial plate that would have shown a hook in the front.
Okay.
Okay. Or we would have had to done a lot more aggressive treatment in order to hide that. By using dental implants, we were able to restore her smile, and we were able to go ahead and avoid a removable plate for her and any hooks or anything that might show in the front of her mouth.
Okay, we mentioned the second step was putting in those titanium posts. The third step would be what?
The third step is really building the teeth.
So this is similar to other cosmetic kind of teeth in the past? Is that right, or is it different?
It is similar in the respect that the materials that are used are the same. Okay. We use our porcelains, we use our acrylics, all those different things.
You take an impression, and then that is sent to the lab, and they make the teeth.
Exactly, exactly. The difference is that it is supported in a way that that is very tight and the person can chew it.
Not everybody can have this done, can they?
Well, I will tell you that most people are candidates nowadays. 10 years ago, not everybody could have it done. Nowadays, with computer-assisted technologies, bone grafting, our ability to grow bone, we can build a foundation for anybody.
You mentioned computer-assisted. How does the computer assist you?
I can design my case on a dental CAT scan that I put into the computer before I go ahead and do the surgery. So I almost do a virtual surgery before I start. On top of that, I can engineer the case virtually so I can see how it'll function and to see if I want to build it at all. Am I building my house on a good foundation?
Okay, we have 1 minute. We have one last picture or shot of pictures. Let's take a look at those, and can you tell us what they show?
Sure. Okay, this is the second type of case. This is where someone says to me, "Doc, I just want something that feels tighter." Okay? Over on this side, you have no teeth, as you can see, okay, on the upper. The titanium posts were placed, just 3. It's a very economical case as well, okay? On the bottom, after that 6-month period has been taken care of, a bar is built with little ball attachments, and now we have a denture that snaps onto that bar.
Okay, Dr. Spector, thank you very much. That's how we want people to look, don't we?
Oh, I'll tell you. It's great stuff.
That's all the time we have for this week on To Your Health. I'm Dr. Bruce Bonanno. Be wise, be strong, be healthy. We'll see you next time.